Hello, I'm Peggy Curry, Chief Operating Officer for Providence Health Care. I'd like to take this opportunity to talk about an important issue, your safety at home. Our Providence family knows firsthand the devastating impacts of domestic violence. April 3rd, 2019 marked the day we lost one of our own to this horrendous crime. Patty Hernandez was a beloved caregiver in our Environmental Services Department at Sacred Heart Medical Center. Patty is remembered for her warm personality and unforgettable smile. For many of our caregivers, Patty was a ray of light. To honor the memory of Patty, we have pledged to be proactive in recognizing the signs of domestic violence and providing resources to get victims to safety. First, we must understand the magnitude of the problem. 1 in 3 women and 1 in 10 men are victims of domestic violence. That is why it's important that we all come together from every avenue to create an environment that begins to break down this cycle. During the next half hour, you'll see an eye-opening view of the dynamics of domestic violence and our community's hope for a brighter future.
Domestic violence, a lot of people think of as arguments and yelling and things like that. It's much worse. I remember specifically driving into a neighborhood, report of a domestic violence, got on scene, walked into the yard, Christmas trees laying out in the yard, Christmas presents all over the place. You walk into the house and there's a victim in a fetal position with blood splattered all over the wall. You turn the corner and there's the perpetrator popping in the top of another beer. There's nothing like looking into the eyes of a 3-year-old who's tugging on your pants, and you look down and she looks up and says, "Daddy beat up Mommy."
His mother sent me a text and she says, "I'm at the garage." I said, "Okay, I'll be right there." I met her at the garage. She already had the U-Haul backed up and ready next to my garage. So as I stood there just like, oh, I can't wait to be done with this. Just probably another hour and we're good. He comes running full force around the garage towards me with a club in hand. I couldn't believe my eyes that there he was. He just began hitting me with the club in my head. And just kept hitting, and I just kept screaming. I couldn't do anything else other than scream. I couldn't run anymore. Someone tackled him and took him down, and when they took him down, I could hear him screaming, just kill me now, just someone just do something. She took my boys away from me.
I mean, she was bloodied and beaten, and he was there to kill her.
I heard the call come out that somebody had been assaulted with a bat and that there were bystanders that were in the apartment complex that were holding the perpetrator down.
Next thing I know, we're at the hospital. They realized that he had hit me so hard that my skull had fractured, and it was into such tiny pieces that they had to puzzle my skull back together. The residents in my apartment complex, if the doctors even say, if they hadn't shown up what they did, if he had one more hit on my head, I would not be here today. So I thank them so much. They are the reason why I am here today in front of you to share with my boys, my friends, my family, to continue to have a better life than what we've had.
In working with Nicole for quite some time, we did an interview with the detective. Mike Ricketts was here. The officer that was first on scene with her was here, and we were able to do a reunion here, as well as I did ask her questions about her journey.
It was pretty much like a month into it. It was like, everything's great. Oh, I'll catch up with you later, no problem. And then it became where How come you didn't answer my call? Why didn't you answer my text? Well, where were you? What took you so long? Why didn't I do this right? Or you messed this up. You didn't cook this right. Why does my food look like this? We eventually had 2 boys together, and in between that time, it began to progress more. Everything that was ever went wrong was always my fault, and I believed him.
A lot of interpersonal problems that human beings have stem from what are called attachment styles or attachment difficulties. And when we say attachment style, what you're really talking about is people's ability to connect in relationships and to feel safe in relationships. If I feel unsafe in a relationship, right, if I've got maybe a very anxious kind of attachment style and I'm afraid that you're going to abandon me, the fallback is to strive for dominance in the relationship, right? Sometimes you hear people say, if you can't beat them, join them. I think more of the time it's, if you can't join them, beat them, right? If I can't feel connected to you and safe in connection, then maybe my experience is the next best thing is to be the one on top in the dominance hierarchy.
He would call me at work no less than 20 times a day to make sure I was at work, what I was doing. He would constantly, keep track of me and where I was. And I would always, I would call him as soon as I got in my vehicle to be on my way home, and he would time me. Before I got home, I would delete any text messages, any phone calls, anything, because that way he didn't see it. Because he would ask to see my phones. He had to see my work phone. He would have to see my personal phone. There wasn't much physical at first, just kind of sometimes if I said something out of the wrong tone, I would be hit. There's times where we had conversations and he would then get so angry that he would come towards me and put his hands around me and choke me and force me up against the wall. He would threaten myself. He would threaten my boys' lives. He would threaten that he would take us all down.
This community has been very proactive of trying to find out what is that driver, but more specifically, what is the driver of our domestic violence here being so deadly?
We're looking at a new measure called domestic violence, and it's tracked by the Washington State Association of Sheriffs and Police Chiefs. And the unfortunate fact for Spokane County is that for the most recent data, we're 27% higher than the state of Washington's rate is. There's a vast difference between the city of Spokane and the city of Spokane Valley, in that the city of Spokane has a much, much higher rate than the county rate overall and the state rate, almost double.
Although domestic violence happens in private, and that's the nature of how domestic violence works, is that this happens in private, the effects of it are very public. Domestic violence creates very high health care costs. It has higher insurance.
When we look at so many other issues in our community that we're concerned about, even homelessness, why are people homeless? One of the reasons that people are homeless is because of domestic violence, because they don't have a safe and secure home to live in, either with their partner or because they're a child and they're fleeing domestic violence. When we look at rates of addiction in our community in Spokane, and we exclaim like, oh, we have a drug issue or we have a drug problem, one of the reasons that people use substances is to cope with domestic violence that they're experiencing, with the emotional abuse that they're experiencing in their home. There are so many issues in our community that can be related back to domestic violence.
Child abuse and neglect, we identified, was trending in the wrong direction and just unacceptably high. But we also noticed violence and indicators of violence among youth, such as bullying, such as youth suicide, which we know can be linked to all sorts of risk factors. And that really prompted us to do a deeper exploration on what is this concept of violence in our community, what does it look like?
Domestic violence occurs in every neighborhood. It's not based on a specific socioeconomic class. I've been to neighborhoods where houses cost $700,000 or $800,000 and there's domestic violence occurring and has been occurring for years. I've been in neighborhoods where they're struggling to make rent, and so there's no one specific demographic that is going to be responsible for violent crime. There are many variables involved as well.
It's often a question that we get at the agency about why she didn't leave or why he didn't leave an abusive situation. And I think it's really easy for our brains to think that way, but my question is always, why did he or she perpetrate the violence? I think part of it is we need to be really asking the question about not why didn't somebody leave, but why did somebody hurt somebody?
This question, where does the violence come from, is an inherently tricky one. And it's tricky because there's no one answer. Anger is a threat response. I think part of the issue around violence in society is that we've got a lot of threat stuff out there. There's a lot of noise that kind of preloads people in terms of the threat response. So it takes a lot less to kind of push them over the edge.
I don't know how many times I've heard from a spouse, they're a great person until they start drinking. They're a great person unless they're using.
I think a lot of the problem is that a lot of the people, and particularly a lot of men who need help managing their anger, don't ask for it. For them to ask for help would mean that they have to admit to themselves that I have a problem with anger. And a lot of times, admitting that you have a problem with anger means admitting that you treat the people you love the most really terribly.
I think why this keeps happening is that we still have a society that is very afraid to talk about this topic.
Majority of it happens behind closed doors, and people don't see it. They don't know it. When they hear something, they just hear a little argument, think it's nothing. Well, it could be more than nothing.
Even though we know it affects such a high percentage, and therefore it affects people in our direct life. We all have a family, a friend, a mother, a sister who has experienced this, but yet we still are a little afraid to talk about it. I think in the past we always approached domestic violence as that's a private family issue, but I don't think we can use that excuse anymore.
We think of domestic violence oftentimes as far as what we can see visually, as do we see bruises, do we see marks, are they reporting that someone's yelling at them or saying hurtful names? But it's so much more than that. When you look at the idea of why doesn't she just leave, we know that because there's financial controlling involved, because kids are often used in that power control dynamic as far as custody issues. We know that animals are often used, pets that someone cares for. There's just so many different things that go into that. We can't just look at it in one dimension.
Oftentimes we have individuals who think that these are choices people are making, that they should be able to pull themselves up by their bootstraps, and so many of our clients, let alone don't have straps, but don't have the boots. So
I was working up northeast area and a domestic violence call came out, and I was fairly close, and it came from a bystander. So I'm the first on scene, contact a female. Obviously she's the female involved. The other officer contacts the male, and I'm talking with this female, and as I'm talking to her, she just has this hollowness in her eyes. She relayed to me that her partner had just been arrested a couple days before for domestic violence. We developed probable cause for another arrest, so he ended up going to jail for domestic violence for assaulting her. But she was with him a couple days later, and I asked her, why do you stay with him? And not in accusatory, what are you doing, but truly wanting to know. So we're sitting at the side of the road, and she breaks down and starts crying. She talks about she doesn't have a place to stay, she doesn't have food, she didn't have money for boots, and she was dependent upon him for the basic needs of life that we all have.
But there's also the side too of at times this person who may be hurting her or him now, this person was also somebody who was very loving at a time. So we also need to respect that for some survivors, there's still love, even though there's also still pain.
Children are the unseen victims of domestic violence.
One of the hardest parts of going to domestic violence calls are when there are children present. There are children of various ages that are witnessing this, sometimes verbal abuse, sometimes physical abuse, between parents, between relatives.
What we see when there's chaotic caregiving or there's violence that operates inside a family, that this puts the children in a situation of tremendous persisting stress. So what we're particularly concerned about is the impact of stress hormones like cortisol, as one example, on the developing brain. And what we've learned over decades, at least, of research about this is high persisting levels of stress hormones in the developing brain actually can act as a neurotoxin. It can actually kill nerve cells at critical points of development.
Domestic violence is systemic. It's a learned behavior. Children that witness domestic violence are more likely to engage in domestic violence either as a victim or a perpetrator.
My first interaction with this young man is when he was a child, and I was a therapist working in a sexual assault program, and I had worked with him. He had been a victim of sexual abuse, and most likely because he was escaping his home, trying to find someplace safe to go because of the domestic violence that was going on in his home. And years later, when I changed positions and I was working in another agency, I saw him walking through the doors to be supervised on a crime. And so it really went to my heart, the fact that, here's this young man that didn't really have a chance.
Mostly what we end up seeing is that violence was characteristic of their childhood, their adolescence, and now into their adulthood. So we have the most vulnerable kids often are being raised by the most vulnerable adults because they come exactly out of the same kind of history.
Every time I experience an emotion and then behave in a certain way, I'm teaching my son what you do when you're experiencing that emotion.
And when we end up looking at the impact, what we see is that persistent exposure to stress when you can't escape and you can't change the circumstances leads you to some pretty fundamental ways that you learn to adapt. You tend to retreat into flight as a strategy, for example. So what we know is that struggle to adapt also begins to shape how the brain is developing. Impacts on educational outcomes. We know that research our group has done is that when you see these kinds of chaotic experiences piling up in children's life, it has got a direct predictive ability to attendance rates, to reported school behavior problems, and to academic success.
If we don't put a stop to that, it creates a higher likelihood of unemployment, drug abuse, alcoholism, lack of finishing school, problems that we deal with now in our whole downtown core, and you wonder how much of that was caused by what that person went through as a child or didn't. So if we can put a stop to it now, it may be a long-term payoff, but maybe years down the road where we're not having quite the homeless problem because we put a stop to domestic violence.
One of the biggest calls that we go on is domestic violence. And from day one, you're going on call after call of domestic violence. And it ranges all the way from just verbal, all the way up to serious injury as well.
We had a domestic violence situation where the husband had stabbed the wife, had killed her in front of the 14-year-old, had then tried to cut the 14-year-old's throat. When that 14-year-old was talking to the detectives had a very hard time dealing with that. So we ended up having to get, counseling for the detectives, counseling for the people that were on the scene.
They are one of the most dangerous calls that we go on as officers. It's typically a very volatile situation that has to be dealt with delicately. The impact of domestic violence calls on officers is very deep. And because it is one of the most common calls that we go on, they are the most traumatic.
There are times that the emotional toll that it takes across the board in society, we're not immune to that emotional toll.
There's a reason why officers die 10 years younger than the national average. There's a reason why officers have higher alcoholism rates, higher heart attacks. Officers commit suicide more every year than those who are killed feloniously. Officers have more domestic violence rates themselves. All of that trauma builds up, and it leads to trauma within them, and sometimes it may rise to the level we call PTSD, sometimes it may not, but I would be shocked if every officer who's been in this job for more than 6 months doesn't have some trauma at some level from dealing with these types of incidents.
I know our police department has done an amazing job at being trauma-informed in a lot of their training, including trauma-informed training for themselves of how I deal with my own trauma in the work. And so I think Spokane has a unique relationship with our police officers, and I see them trying to be better with this, but there's always room for growth.
We do a lot of training. We have brought in the Lethality Assessment program.
Lethality Assessment is designed so when an officer responds to the scene of a domestic violence, there's certain criteria that mandates that the officer go through that lethality assessment, which is that little blue card that they ask you questions from. And certain yes answers and certain number of yes answers screen a victim into that. The officer then calls the advocate hotline, explains to the advocate what happened, and then tries to get the victim on the line with the hotline worker, so the hotline worker can do safety planning.
You have to put yourself in the shoes of a lot of these victims where you have just taken away potentially their livelihood, and their immediate concern is probably, well, one, I'm glad I'm safe, but two, now what's going to happen when this person gets out or when I no longer have a place to stay? What these advocates are there to do is to help them work through that process and that uncertainty. One of the benefits of these advocates as well is that a lot of them have experience with it. And if we can connect them with someone who understands their emotions without even having to ask what they're experiencing, it helps give them a more effective response in getting the resources they need.
Is it working? Well, I think we're seeing more and more reports of domestic violence because that is one of the things that program does, is encourage victims to make sure that they report and try to get that victim help before it escalates to the point where, it is lethal.
Seeing yes on those, I was like, why didn't I see this sooner? Why didn't I see all this? I mean, I know it happened, but reading it and it being in front of your face and those questions asked you is kind of like in your face.
Unless you've been a victim of that, you don't understand the magnitude of somebody, especially somebody that you love, saying, I'm going to kill you. And actually, you know that is a possibility.
This, in my view, is probably one of the most powerful positions when it comes to mental health. When you're interacting with this person who's just been a victim of the crime, the worst day of their life, what you say to them at that point is either going to help them heal and move forward, or it's going to send them spiraling further down. What we can say and do to them right then and there is immediate. So we also need to understand that how we're interacting with them is going to have an impact on them as well, beyond just taking that incident report.
I'm assigned to our Major Crimes Domestic Violence Unit. We are co-located at the YWCA with prosecutors and advocates in what's known as a Family Justice Center, because we know that one part of the process, whether it's prosecutors, advocates, or law enforcement, can't solve domestic violence on its own. So we work together in a team concept to stop domestic violence in our community. The officers in our unit will go into the jail after an offender has been arrested for domestic violence and have a sit-down conversation with them and let them know that domestic violence is not like any other crime.
So officers are contacting offenders, whether they're in custody or out in the community, and just to let them know that we are aware of what's going on and we are paying attention. And hopefully that will be able to, even in the back of their mind, keep their behavior possibly in check.
We're going to use everything we can to prosecute them if they choose to continue this behavior.
I think the court needs to do a lot, but we also need to understand that the court is very limited because of the nature of how we prosecute. One way that we're trying to help courts understand this is that it's about trauma-informed interviewing of a victim. It's very hard, if we try to interview a victim right at the scene of the arrest. The way that trauma affects the brain is that that's not a very suitable interview to hold up in court beyond that reasonable doubt.
The face of domestic violence is ugly. And the hardest part is trying to make sure that we get those victims the help that they need. That's one of the things that the YWCA focuses on, to try to get the victims the help they need. Our job is to make sure that they have the justice that they deserve.
What we know about violence is it's not just one sector that's responsible, but it's all of us that have a contribution to prevent violence and mitigate the effects. And I think we're really seeing the community rallying around this concept of we got to work together to do something about the stats we're seeing. We need to turn the curve and fight.
We need to be talking about it so that, first off, survivors feel safe coming forward because it's not a taboo topic, and so that perpetrators can feel like they're held under a different accountability if this is not something that is shied away from.
Schools, I think, are doing a lot better job at working with this. with kids. We're, as a culture, beginning to recognize that this is something we need to pay attention to.
Through the prevention technique, we're really looking at educating youth about healthy relationships and healthy communication. But I think we also have a broader task as an agency and as a community about how we're shaping young boys and girls to fall into stereotypes and behaviors that can lead to victimization or perpetration. So that's breaking down some of these stereotypes of this toxic masculinity and what it is to be a man, and also working with young girls to feel more empowered to speak up in relationships where they may have been conditioned through media and through our society to stand down to power. So it's teaching young children a different type of relationship, really, both within themselves, their peer group, and with romantic relationships as well.
Well, we have a lot of great programs that serve some of our most marginalized people in the community.
Part of it is just helping them realize there is a problem, and then within the community, when they do make a change, it's really that mobilization of multiple community partners coming together to support a family.
The coalition consists of law enforcement officers, probation officers, healthcare workers like nurses in our hospitals, victim service organizations like the YWCA, agencies that serve youth and children around the issues of child abuse, people that are strategically placed in our schools, lots of different people who really care about our community.
The cool thing about Nurse Family Partnership is that it's prevention. It's primary prevention.
We offer parenting classes, not just for the mom, but for the dad. We're working on spacing out the intervals between when they have children. We're getting them vaccinated. We're ensuring that they have transportation, that nutrition's going well. The more things we can check off the list of what's stressing those families out, the better.
And we talk about what does a healthy relationship look like. And then we say, well, what about on bad days? What do things look like? We have an evidence-based tool that we use to screen for intimate partner violence at that time. And we say, you can tell me whatever you want to on this. This is your information. You are in control. So I work to empower my clients. That's really important, to give them that agency when they're in a relationship that is based on power and control, and having that taken from them.
Sometimes well-meaning people rush in to make a change for a family that's not ready to make the change. And so if you're there and you're pushing, you're kind of exerting the same power and control that they already have occurring in their home. So if they aren't even really aware that there's a problem and you're coming in to make a change, it's going to be met with a lot of hesitation and probably a lot of fear. So I think providers and even friends just being with, joining in, meeting people where they're at. You can always provide those crisis resources, but not force people to use them. Say, I want you to know that this is here for you when you are ready, but I'm not going to make you make that change if you're not ready.
Officers cannot be everywhere at once. We know this. We need help from the community to report when they see domestic violence. Please report it, and we will do our part in order to stop this domestic violence cycle.
The one thing we talk the most about the movement is that we need to have a society that just believes survivors. Naturally, our brain wants to question why these things happen instead of just believing somebody. If we believe somebody, it's amazing the internal power of a survivor to reach stability on their own. But if we have better support systems for them and just that emotional support system, I think we can see people heal faster in their process.
I look forward to every day now. I used to not look forward to my days, and now I look forward to every single day I have. If I would have said something, the boys and I could have been out sooner and been protected sooner, instead of me thinking I'm all alone and I could do it by myself. You need to say something. Don't be afraid. I was afraid, and I was afraid for so many years. No matter how bad you think that you have it, or that you think that that abuser is going to hurt you, there is help, and there is a way to get you out fast and safely. Say something. That's the most important thing, is say something.
Thank you for taking the time to learn more about this epidemic affecting our community. Together with our partners in the greater Spokane area, we continue to bring this important topic out of the darkness.